Hello, my name is Delina Ricks, and today I will be discussing post-traumatic stress disorder. Awareness of this disorder can assist transitioning veterans and others suffering in silence to seek help. Not all wounds are visible. Understanding how PTSD affects the brain allows for further understanding of how the disorder affects the brain, causes changes in behaviors and physical changes within the brain. This knowledge provides self-awareness and can reduce triggers and symptoms unique to the individual. Here is an overview of my presentation. I will explain PTSD, how it is diagnosed, its core symptoms, and risk factors. I will also discuss how PTSD affects the brain, what it's like living with PTSD, both professionally and personally. I will also discuss how this disorder impacts one's health. And I will conclude with a summary. To understand how PTSD affects the brain, one must understand the disorder, its symptoms, how it's diagnosed, risk factors, and treatment options. Post-traumatic stress disorder is a disorder that may occur in people who have experienced or witnessed a traumatic event, such as a natural disaster, serious accident, a terrorist act, war, combat, rape, have been threatened with death, sexual violence, or serious injury. There are three core symptoms: re-experiencing, avoidance, and hypervigilance. Re-experiencing is when an individual continues to relive the trauma through upsetting memories or nightmares. Avoidance is a natural response. An individual will begin to avoid people, things, and places that remind them of the trauma. Lastly, hypervigilance refers to being easily startled, on edge, and feeling really tense. There are also other symptoms such as arousal and reactivity issues, and cognition and mood swings, anger, and memory loss. However, the three highlighted are the most common. There are risk factors that can make an individual more susceptible to developing PTSD. Of course, the first is experiencing a traumatic event, but also genetics, life stressors, existing mental health conditions, previous trauma, and neurological issue can also contribute to PTSD development. Diagnosing PTSD. A doctor experienced with mental illness, psychiatrist, or a psychologist can diagnose PTSD. According to the DSM-5 guidance, an individual must have all of the following at least for 1 month. At least one re-experiencing symptom, one avoidance symptom, 2 arousal and reactivity symptoms, and 2 cognition and mood symptoms. The neurobiology behind PTSD involves 3 regions of the brain and their functions: the hippocampus, the amygdala, and the prefrontal cortex. Looking at this diagram, we can see there are 3 regions of the brain that are affected by PTSD. The brain changes in those who have PTSD. PTSD causes the hyperactivation of some brain structures while others become hypoactive. Specifically in the 3 major areas, the hippocampus, the amygdala, and the prefrontal cortex, as I mentioned. The hippocampus, an area that helps distinguish between past and present memories, is involved in the encoding of context during fear conditioning. It shrinks in size. When the hippocampus fails to function optimally, it impacts the way the individual remembers and recalls memories, especially memories related to the trauma. This experience causes strong emotional responses that are hard to calm. The amygdala, the region of the brain that processes emotion and fear, increases activity. The overactivity of the amygdala presents hypervigilance and the exaggerated startled response. Because of the amygdala overreacts, norepinephrine, I'm butchering that word, is released, but then not adequately controlled or dealt with by the prefrontal cortex. Traumatic stress is associated with the release of cortisol and norepinephrine, the stress hormones. Individuals with PTSD experience increased levels of these elements in their response to stress. The prefrontal cortex, the region of the brain that regulates negative emotions that occur when stimulated, also shrinks. The disruption with these systems contribute to PTSD symptoms, and knowing these provide avenues for research. Living with PTSD can make an individual feel incapacitated, both in their personal and professional life. PTSD symptoms can make an individual behave distant and disinterested. Although the triggers and onset symptoms are unpredictable, this directly impacts their relationships with their families, friends, and significant others, also making it difficult to establish new relationships. Some individuals turn to unhealthy ways to cope or self-medicate, like alcohol and drugs. This also impacts their personal and professional life. Coping with PTSD. Treatment options are unique to the individual and the severity of the disorder. Effective treatments include counseling and medication. Trauma-focused treatments are the most effective. Coping strategies like exercise, counseling, journaling, lifestyle changes, spending time with others, meditation are also very much encouraged. PTSD can disrupt one's whole life, relationships, career, enjoyment of everyday life, and yes, even one's health. PTSD can increase your risk of additional mental health issues, depression, anxiety, but also physical health issues like cardiovascular, autoimmune, musculoskeletal, digestive, chronic pain, and respiratory disorders. Chemically, individuals with PTSD experience increased levels of stress hormones in response to stress that can lead to chronic fatigue, depression, and back pain. During this presentation, I explained PTSD, how it is diagnosed, its core symptoms, and risk factors. I also discussed how PTSD affects the brain, what it's like living with PTSD, as well as how the disorder can impact one's health. Understanding and being aware of this disorder can not only help you, but also others struggling to seek help. Remember, just because the wound seems invisible doesn't mean that it does not exist. Thank you so much for your time today.